Greetings and welcome. Today we delve deep into a subject that is medical, legal, ethical, and societal. The legislative aspects of abortion. This complex issue intersects law, medicine, and moral values, explaining why it continues to spark debates in many countries. Starting with the medical-legal definition, criminal abortion refers to a deliberate termination of pregnancy without a medical necessity. In other words, it involves the intentional, premature expulsion of the conceptus outside of a recognized therapeutic indication. Historically, various methods have been used to induce an illegal abortion. Some are based on toxic substances of plant, mineral, or chemical origin. Their common denominator is their danger. These products can cause severe damage to the mother, such as liver, kidney, neurological, or cardiovascular damage, sometimes fatal. Other procedures are based on direct or indirect mechanical maneuvers, from physical trauma to the introduction of instruments or liquids into the uterus, exposing to severe complications such as perforations, infections, or hemorrhages. From a diagnostic perspective, proving an induced abortion can be challenging, especially in a living woman, as some maneuvers leave no visible traces. However, certain clinical or biological signs can alert the physician, including persistent bleeding, signs of poisoning, or genital lesions. In post-mortem cases, anatomical examination of the uterus and the search for characteristic elements sometimes allow for a diagnosis. Complications related to these clandestine practices are frequent and severe, including severe infections, gas embolisms, uterine perforations, shock states, or acute poisonings. Turning now to the legal aspect, in many legislations, abortion performed outside the conditions set by law constitutes a criminal offense. Sanctions can target the perpetrator, accomplices, or even illegally involved health professionals, with prison sentences, fines, and sometimes a ban on practicing. The law also provides provisions concerning incitement or publicity around these practices. However, there is a major exception: therapeutic abortion. Therapeutic abortion is permitted when pregnancy severely endangers the life or health of the mother, or when a severe and incurable fetal pathology is diagnosed. In these situations, the decision must be framed by a strict medical procedure involving several doctors and a specialized structure. On the ethical level, the principle is clear. A doctor can only perform a termination of pregnancy in strict compliance with the law. This framework aims to protect the patient, the practitioner, and society. Finally, some religious traditions also address the issue. In classical Islamic jurisprudence, for example, the majority of schools consider abortion forbidden after a certain stage of fetal development, unless the mother's life is threatened. In conclusion, the issue of abortion cannot be reduced to a simple medical or legal decision. It involves scientific, legal, moral, and human dimensions.